The burden of skin disease is a multidimensional concept that encompasses psychological, social, and financial consequences of the skin disease on the patients, their families, and on society. Therefore, care must be taken to treat it effectively. Firstly, you should know that skin problems may present as patches of abnormal skin that may itch or blister and appear scaly or crusty. Secondly, you should be aware of all such aggravating factors which make skin problems worse, like scratching, contact with an irritant such as poison ivy or wool. Now there are some important questions that you need to ask your patient before making a diagnosis. You will ask the patient what symptoms they are experiencing, including fever or chills, any previous skin diagnosis, the results of previous skin biopsies, effects of past treatment with antihistamines, steroid pills or creams. You will ask your patient if they or anyone in their family have had any of the conditions like diabetes, kidney disease, asthma, hay fever, skin diseases such as eczema, psoriasis, or contact dermatitis. You will ask the patient how the problem started, how it has changed over time, how many regions of skin are affected, and if the problem appears to be healing or spreading. Next, you will ask the patient if they are taking any medications. You should also ask the patient about any recent contact with someone with a similar problem, the nature of their work, and if they ever come into contact with certain dusts, chemicals, or pets. Now that you know the symptoms of your patient, you have to examine the patient. Well, this physical examination includes temperature and thorough skin examination. Now, what can cause skin problems and what is typical for each cause? Well, there are different causes of skin problems that you should be clear about. If the patient shows symptoms like redness, crust, and scales, then this might give you an indication that the patient has eczema, which is defined as a rash response to allergies, poor circulation, or sunlight. But if it occurs often on the hands and feet, most common in children and young adults, then this might be an indication to wart, which is a bump on the skin caused by a virus. And what if your patient is having blackheads, whiteheads, elevated spots filled with pus, most often found on the face, back, chest, and shoulders? Then these symptoms might be caused by acne, which is an inflammation of the glands and hair follicles, producing pimples. And if skin problem is accompanied by scaling red patches, hair loss, and broken hair, then fungal infection of scalp might be a reason to this. Well, this is characterized as invasion of fungus in the skin of the scalp. Now, if the patient has skin problem along with itching, scaling, inflamed patches of skin, blisters that may heal in the center but spread, forming a ring, then this might give you an indication that patient has fungal infection of body. Well, fungal infection of body is invasion of fungus in the skin. Now, if skin in groin region appears as itchy, red, scaly that spreads to other skin regions, then this might give you an indication that patient has fungal infection of groin. Well, fungal infection of groin is invasion of fungus in the skin around the groin. Now, if the patient shows symptoms like itchy, blisters on the palms of the hands and soles of the feet, scaling and tears in between toes, then this might give you an indication that patient has fungal infection of feet and hand. Well, it is defined as invasion of fungus in the skin of the hands and feet. Now, if the patient shows symptoms like patches on the scalp or knees or elbows, often itchy, may spread to nails, groin, or entire torso, occurs only in adults, then this might give you an indication that patient has psoriasis. Well, psoriasis is a disease marked by recurrent episodes of itchy, red, and scaly skin. But what if your patient is having Scaly patches on the scalp, eyebrows, back of ears, upper lip, chest, or groin. Then these symptoms might be caused by seborrheic dermatitis, which is in fact white or yellow scales on the skin, which may flake off, also known as dandruff. What if your patient is having red spots and blisters that blend together to form a honey-colored crust? Occurs in children, most often on the head, neck, and diaper area. Then these symptoms might be caused by impetigo, which is a contagious skin disease caused by bacteria. Now, if your patient is having tender spots, normally found in skin regions that contain hair, then these symptoms might be caused by boils, which is a swollen spots caused by a bacterial infection of a hair follicle. But if your patient has itchy and pink patches of skin, may occur after eating shellfish or unusual foods, or after taking certain drugs, then these symptoms might be caused by hives, which are in fact disease-raised red welts on the skin surface. What if your patient has skin problem with itchy spots and blisters often found in warm body regions, such as between fingers, near the nipples, navel, knees, and groin? Then these symptoms might be caused by scabies, which is a state of contagious skin condition caused by mites. What if your patient is having itchy spots, hives, bloody crusts on skin regions with hair? Then these symptoms might be caused by lice, which is a contagious skin condition caused by wingless insects. Now, if your patient is having oval, salmon-colored scaly patches of skin on the trunk, occurs mostly in young adults, then these symptoms might be caused by pityriasis rosea, which is a rash of unknown cause. Now, if your patient presents with red and moist skin spots, which are itchy, painful, and occur most often in diabetics and children, and on moist skin regions, such as the groin and base of the nails, then these symptoms might be caused by yeast infection, which is a skin inflammation caused by yeast. Now we will discuss the skin problems that are commonly seen in children. What if your patient is having red cheeks, rash on torso, and slight fever? Then these symptoms might be caused by papavirus, which is the same virus that often causes warts in adults. Now, if your patient is having highly itchy blister-like spots found primarily on the torso, spots crust, over several days after they first appear, then these symptoms might be caused by chickenpox, which is a contagious disease marked by skin spots and caused by a herpes virus. Now, if your patient has fever, swollen lymph nodes in the neck, followed by sudden rash on face that fades after 1 day, and followed by a similar rash on the torso, legs, and arms the next day, then these symptoms might be caused by German measles, which is a contagious skin disease that is less severe than measles. And lastly, if the patient has cough and fever for 3 days, followed by a purple-red rash that starts at the head and spreads to the rest of the body, then this might be an indication that patient has measles, which is defined as contagious skin disease caused by a virus. So now, if you are clear about your findings, you can manage your patient accordingly or do further investigations if required. That was all about the differential diagnosis of skin problems. Just wait for our upcoming video on differential diagnosis of eye problems, only on sqadia.com.